Hello, thank you for joining us. We'll get started in just a few minutes. Hello, thank you for joining us. We'll get started in just a few minutes. Hello, and thank you for joining us today. We are ready to begin. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by American Nurses Credentialing Centers Commission on Accreditation. The planning committee members and speaker have disclosed no relevant financial relationships. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into the learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we'll have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to our presenter. Be sure to hit send so the message makes it to us. Please use the Q&A for questions and the chat feature to interact with other participants. We'd like to thank our speaker for sharing her expertise with us today. Our speaker today is Kelly Freeman. Kelly is the current Director of Academic Advancement at the American College of Lifestyle Medicine. Previous roles include Lieutenant in the United States Navy Nurse Corps, Wound Consultant, Legal Nurse Consultant, Adult Geriatric Primary Care NP, and University faculty. She holds 2 postgraduate certificates from Indiana University and in Public Health and Nursing Education. She has co-authored 2 book chapters and has co-written research papers on lifestyle medicine reimbursement, shared medical appointments, provider burnout, and cost savings. We're so grateful to have you, and we'll turn it over to you, Kelly.
Thank you very much. It is an honor to be here today, and I'm so thrilled to see all of you from all over the United States and globally all over the world. So thank you for joining me. We're going to be talking about lifestyle medicine. And if this is something that is new to you, that does not surprise me. This was very new to me 10 years ago. And so I am just honored to present information about this topic. And again, my name is Kelly Freeman. I am going to give you my contact information here at the beginning and then also at the end. Don't hesitate to reach out to me if you have any questions about anything that I am presenting today. And the objectives for this next hour are first to define lifestyle medicine. What really is it, and how can nurses utilize lifestyle medicine in their practice? Understand how it is an essential component of healthcare, and also recognize the opportunities and the tools and the resources that can be invaluable to help move lifestyle medicine forward within your clinical practice. So let's first define lifestyle medicine. It is a medical specialty that utilizes therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including, but not limited to, cardiovascular disease, type 2 diabetes, and obesity. Lifestyle medicine certified clinicians are trained to apply evidence-based, whole person, prescriptive lifestyle changes to treat, and when used intensively, often to reverse conditions. And so, in a way, lifestyle medicine is incredibly simple. It is built on 6 powerful types of interventions, and those are related to nutrition, sleep, activity, the avoidance of risky substances, stress management, and positive social connections. However, this is also incredibly complex, so we'll talk about that. Now, you may be wondering how lifestyle medicine differs from some of the other disciplines that you've heard of. So again, lifestyle medicine, pure and simple, therapeutic lifestyle interventions. And so we don't tend to use supplements. However, there are a few that are used, and those are the ones that are commonly either vitamins or minerals that are depleted in the body. Vitamin B12, vitamin D are often utilized. But other than that, in every situation possible, we try to get nutrition from whole foods. So this differs in that preventative medicine, while it does have a lifestyle medicine component or components, is really heavily focused on early detection of disease and screening. Functional medicine has more diagnostic tools that we don't tend to use in lifestyle medicine, nutraceuticals, supplements. Naturopathic medication may have some herbal remedies that may be pill form. And when we utilize herbs, spices, we do that in the whole form through lifestyle medicine. And then finally, integrative medicine, which you may be hearing more and more about, is utilizing conventional medicine along with evidence-based a complementary medicine, and certainly lifestyle medicine can fit very nicely within and underneath an integrative medicine umbrella. Now, here's another way to conceptualize it. So with this model, you see lifestyle medicine is in the center, and it can be utilized within primary care, pediatrics, OB, within specialty care, especially endocrinology, cardiology, neurology. And then it has such a strong science component, epigenetics, the microbiomes, psychology, nutrition, healthy aging. So it's complex and fits so nicely into so many areas of medicine, science, and health. All right, so as the title of this presentation stated, lifestyle medicine is person-centered care. The person is in the center of all of this. What would they like to do? What matters to them? How can we, as nurses, help them get to the highest level of their health? And that is our goal. We want optimal outcomes. We want people to be able to live longer lives and healthier lives. This is high value care. There's lots more talk about high value care and cost effectiveness. And this is healthcare that improves health, so better outcomes, avoids harm. There really are very few side effects of lifestyle changes. And eliminates wasteful practices. So if we're able to help our patients implement simple lifestyle changes that in some cases may prevent them from needing further interventions or medications, wasteful practices, then that's exciting. And finally, this is evidence-based care. And we all know that it takes a while for research to move into our clinical practice, but I am seeing this on a daily basis with lifestyle medicine. There are more and more research studies, there's more and more data just showing how powerful these lifestyle interventions are. And so it's a really exciting time to be working in this space. And the time truly is now. We have a situation, and this particular slide just looks at the US, but throughout the world, we have more and more chronic diseases. And specifically in the United States, we're spending $4.1 trillion annually on healthcare. And there's just been an increasing prevalence of all types of chronic diseases, and it just is not sustainable. And our CDC estimates that of all the money that we're spending, 90% of it is for chronic and mental health conditions. So there's a vast opportunity to save money and improve outcomes through lifestyle medicine. And here is, just how much opportunity we have. One Mayo study that had a sample size of 4,745 people demonstrated that of those, less than 3 were living what was considered a healthy lifestyle as defined by just 4 qualifications. The first being exercising at least 150 minutes a week. A dietary score that's in the top 40%, still not incredibly healthy, but a healthier eating pattern, a bit lower body fat average, and then also not smoking. So just 3% met these qualifications. And now we're looking at the World Health Organization coming out with a white paper late last year that said that it's very likely we need really 300 minutes a week to optimize health. 150 is the minimum, but we likely need more than that. So we really do have a lot of work to do. And just in this physical activity space, humans are meant to move, and our current environment and what we do, we just are not moving. And so even that, that one part of the whole lifestyle medicine intervention, basket is very impactful. Okay, so let's look a little bit around the world. And I mean, we have, millions and millions of people. About a third of us will die from heart disease. But before dying, there's also the heart attacks, the strokes that occur. So a lot of disability that goes along with that. And when you look at the second to the last sentence there from the World Health Organization, most cardiovascular diseases can be prevented by addressing behavioral risk factors, such as those that we address in lifestyle medicine. And it is important to detect cardiovascular disease or as early as possible so that management with counseling and medications can begin. So we can take that counseling word and know that there are so many interventions that we can do through a lifestyle medicine lens that can really, really impact cardiovascular disease. And we'll look at some of the research related to that. Same with diabetes. So again, we have a tremendous amount of people who have diabetes around the world. And we're talking about type 2 diabetes here. And a healthy diet, regular physical activity, maintaining normal body weight, and avoiding tobacco use are ways to prevent or delay the onset of type 2 diabetes. So what a wonderful world we could live in if we could prevent as much of diabetes as possible, but also put it in remission. And we'll talk about some of the research and the initiatives to do that. So diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, regular screening. So again, a sweet spot for lifestyle medicine. Okay, and depending where you are in the world, you can see here how much we spend in healthcare, on healthcare. In the United States, unfortunately, we're a bit of an outlier here. We spend a lot of money on our healthcare, and that amount has gone up. In the meantime, the US life expectancy, unfortunately, is quite a bit lower than many of the other countries, 5 years lower on average than Japan. Similarly, with many of the other countries that have a much higher lifespan. So we've got a lot of work to do. This shows the percentage of adults in the United States. So this is over the age of 18 who have chronic conditions, multiple chronic conditions. So again, we're up there. And kudos to France and Switzerland, the Netherlands, for having much lower rates than we do in the US. Also, the United States has a much higher obesity rate than so many of the other countries, with, on the other end, Japan, Korea, Switzerland, Norway, and the Netherlands having much lower rates than world average. So, we all know this. We've seen this in guidelines. Lifestyle change is the first line of defense. Clinical guidelines state that diet and physical activity changes are critical, along with all of those other lifestyle changes that can be made. And this is it's so impactful when someone is diagnosed with a new chronic disease, if we can initiate intensive lifestyle measures right then and there. It can just make a tremendous difference in the trajectory of our patients' health. And so we see that with angina and diabetes, lots and lots of opportunities for us to intervene. And, it just gets a little tricky in healthcare because it's busy. We don't have very long to spend with our patients. And so sometimes lifestyle interventions may get overlooked, and we can't overlook them anymore. Here's one more example of a guideline that first and foremost mentions lifestyle changes. And so this is an American College of Cardiology guideline, and it states that in younger adults, so 20 to 39 years of age, an assessment of lifetime risk facilitates the clinician-patient risk discussion and emphasizes intensive lifestyle efforts. And that word intensive is important because that's what we're talking about with lifestyle medicine, and it's dose dependent, and it's not always possible for everyone to change their lifestyles, but Small steps can make a difference. Small changes can make a difference. And if there are those who are able to make some major changes, it can have a tremendous impact. And this guideline also states that for all ages, lifestyle therapy is the primary intervention for metabolic syndrome. Lifestyle is. So the leading cause of chronic disease, disability, and death throughout the world is actually dietary patterns and dietary risks. And in the United States, it used to be tobacco smoke, but since we have less people smoking, thankfully, than we used to, and more people who either don't have access to healthy foods or have chosen not to consume them, we just have a way higher risk through dietary practices of disability and death. And I think sometimes this is hard to believe, but one way to think about this is that each of us, each human adult around the world, consumes about a ton of food a year, a ton. So that's a tremendous amount of food. And if we don't think that impacts our health, then we need to rethink that, because it absolutely does. You may be wondering specifically, like what parts of the diet make the most difference? And there are studies that have parceled that out. And so that is what this slide is going to show you. One of the most impactful projects, research related to chronic diseases is the Global Burden of Disease study. And you can find information about this study from the University of Washington online. There's open access to it. And so basically what they did is looked at dietary factors that accounted for 11 million deaths, and also looked at disability. And the three main impacts, the three main risks were with high sodium, low whole grains, and low fruits. Now, if we want to parcel that out just a little bit more, you can look at this at the middle of the slide here, and you can see that cardiovascular disease tends to be most affected by a diet low in whole grains. And then secondly is a diet high in sodium, and third, a diet low in fruits, fourth, diet low in nuts and seeds. And I won't keep reading, but you can see, that there are some parts of our dietary pattern that are incredibly impactful related to cardiovascular disease. So if you're working with someone and you can make a suggestion or write a dietary prescription, this is where you can have the most impact. First, go for those whole grains. Are they eating steel cut oats once a day, or whatever grain they love? At least trying to get them to eat more and more of those whole grains, more and more of those nuts, seeds, fruits. So those are highly impactful as far as cardiovascular disease goes. And then you can see the same with the darker peach color with diabetes. If we can get people to, again, eat more whole grains, that can be quite impactful. Okay, so let's dive into a little bit of the science behind why lifestyle is so powerful. And I think that this slide does a great job of demonstrating this. Of course, this is incredibly complicated. What we have over here on the left are parts of a lifestyle that are unhealthy. So you've got the diet, where we can be sedentary, high amount of stress, etc. What happens when this is going on is that there are quite a few microbiome alterations. There are epigenetic changes. So those are the genes or genetic traits that can get turned on and off. So when bad things are happening with our lifestyle, that tends to turn on the bad genes and turn off the good ones. And then we can do the opposite of that if we have healthier lifestyles. And then also the unhealthy lifestyles tend to cause more cellular stress, cellular injury, and all of this leads to inflammation. And then that inflammation is such a large part of so many of our non-communicable chronic diseases, obesity, type 2 diabetes, etc. So when we can intervene with lifestyle interventions, we can have a healthier gut microbiome, positive, good epigenetic changes, less inflammation, less cellular stress and injury. Okay, and this study, this European study shows if we take 4 different aspects of a healthy lifestyle. So we're looking here at not ever smoking, having a BMI that's below 30, at least 3.5 hours of physical activity a week, and a fairly healthy diet. Looking at each of those as a health index of 1 point each, the more health index points there are, the lower the risks of, on the left-hand graph, diabetes, and then secondly, MI, and then over to the right, stroke and cancer. And you can see when you look clear to the left that by far lifestyle affects diabetes and cardiovascular disease. I mean, this is huge, but also will affect stroke and cancer and other chronic diseases. Okay, and going back and looking again at opportunities for modifying dietary intake, what makes a difference again? When we look at a typical Western diet as compared to an optimized diet, and by optimized diet, we mean one that is more of a whole food, primarily plant-based diet. So lots of fruits, vegetables, nuts, etc. Maybe a little fish and staying away from those sweetened beverages and refined processed foods. And even in people who are elderly, so 80 years of age, it can impact their life expectancy by 3.4 years. So by eating an optimized diet, it can make that much difference. And again, the biggest gains are from, number one, whole grains. We already knew that, but then also adding more legumes and then adding more nuts. So less red and processed meat does make a difference with this. And you can see over to the left, the green arrows going up and the red arrows going down to help, navigate the different dietary pieces. Okay, so this study goes back quite some time, and this was the original study of Dr. Dean Ornish and his team looking at their lifestyle medicine program. So this is called intensive cardiac rehab. You all probably have heard of regular cardiac rehab, 36 sessions, and most health systems have regular cardiac rehab in place. It is CDC or Medicare approved to stop or to prevent further cardiac events. So the hope with getting people into cardiac rehab is that they will not have another heart attack. They will not have a stroke. That is the hope with regular cardiac rehab. Intensive cardiac rehab is twice as long, has quite a few more elements related to lifestyle medicine. And what this original research found, and has been replicated over and over again, is that with that intensive therapeutic lifestyle change, even without statins, over 5 years, there is regression of arterial plaque. So either with the control, which is standard medical care, or interventions, statins or not, both still had progression of cardiovascular disease. And with the intensive lifestyle change program, it was regression of that disease. And this was how I first learned about lifestyle medicine 10 years ago. And I just could not believe that we might be able to reverse heart disease. That really took me some time to digest and to understand that this was a thing. In clinical care, my work was around helping people cope with their cardiovascular disease, making sure that they got the medical care they needed. But we didn't really, at that point, offer the hope of disease remission. So when I learned about this study, I just really dug in and started learning more and more about this. And to me, it just offers so much hope and it's really exciting work. And same with type 2 diabetes. Just in the last few years, we're seeing more and more about diabetes, type 2 diabetes remission. And in fact, just recently, there was a consensus statement by multiple diabetes organizations who said that remission of type 2 diabetes is an optimal, realistic, and achievable goal. Okay, so how far we've come from when I was in school, which was quite some time ago, but we were taught that these chronic diseases are chronic. People are going to need to be on these meds for the rest of their lives. Their diseases are going to progress. And this is really, really exciting stuff. And the thing though with the type 2 diabetes and also with cardiovascular disease and really any non-communicable disease is first and foremost, we have to target the diet. The dietary interventions are huge. And so diet is a primary intervention for type 2 diabetes remission. And what is recommended is primarily whole plant-based foods and a minimal consumption of other products. Okay, and this is a study that looked at an intensive lifestyle intervention and remission of type 2 diabetes, and this was over the course of 4 years, and lots of great outcomes came from this. So significant weight loss, greater fitness, remission of disease. And so in this study, it's like 11% or so. I won't go, you have these slides, so you can go back and take a good look at these later on. But a significant number, I believe 11% had disease remission, so diabetes type 2 remission. With the clinicians that I know and have worked with who have lifestyle medicine clinics, when I have asked them what percentage of their patients approximately do experience remission, it seems to be around 50%. And that's a lot of people who can have achieve remission. And so these people are self-selected, because they're coming to a clinic specifically to try to put their disease in remission. But again, there's some exciting stuff going on in this space. Okay, and I talked a little bit about the importance of physical activity, and this slide just shows you all of the benefits. So the more we can get people to move, the lower their incidence of cancer, different cardiovascular diseases and conditions, metabolic diseases. Then also, it's just better brain health, which we all, want to strive for. So improved cognition, being happier, improved sleep, so much aligns with increased physical activity. Sleep, of course, is incredibly important as well. And even over the last few years, we're really recognizing how incredibly important sleep is. And for those of you who work in the hospitals, I'm hoping that all of you are doing the interventions that you can to try to make sure that your patients are getting sleep that they need. But we know that this is absolutely vital. And this one study showed that it appears that people who receive somewhere between 6 or 9 hours of sleep have the best, optimal cardiovascular health. Now, the real sweet spot seems to be right around 7 hours of sleep, which is a little less than I like, but this is an interesting study. And again, anywhere, we all vary a little bit on what we need for sleep, but certainly sleep is incredibly important for overall health, and so we want to make sure our patients get it. And also a part of lifestyle medicine that I just love is positive psychology and social interactions and helping people to reduce stress. And, all of this makes such a tremendous difference. And so way easier said than done to think positive, but with so many different interventions available to help people think more positively, this can tremendously impact their well-being. Okay, so you may be wondering how this looks in practice, and I am absolutely positive that nurses are very, very well positioned to do so much of this work. This example is if you are perhaps an APRN, if you are if you can prescribe some lifestyle interventions, some very common ones, maybe again, add more fruits and vegetables to the diet, walk after every meal. That's a big one, or exercise, move after every meal. And so here's where I want to caution all of you. And my caution is that these therapeutic lifestyle interventions are extremely therapeutic. And so if we have people doing what we're asking them to do, they can end up with way lower blood pressure and way lower blood glucose levels, which is amazing, you know, for people who have hypertension and diabetes. However, where I want to caution you is that if they're on meds, multiple meds for these conditions, they need to be followed by someone who is able to rapidly de-escalate those meds, to get them off those meds in a timely fashion so that we don't have problems with hypoglycemia or hypotension. And this is seriously a risk. So this is why it's incredibly important that our clinicians, that nurses understand lifestyle medicine. And this is kind of a pivotal point in our patients' care where they can start to go into remission of their disease. But yet there is that risk of, if they're on meds, that may end up causing, you know, some issues. We need to be getting them off those meds. So work closely with the provider, and if you're interested, consider getting certified in lifestyle medicine so you have all the knowledge you need in order to do this kind of work. Because again, these are powerful, powerful interventions. And so I am the Director of Academic Advancement at the American College of Lifestyle Medicine. My primary role is to help faculty throughout the country, nursing faculty, APRN faculty, to move lifestyle medicine content into their programs. And just a little bit about this organization, it is the vision of ACLM is a world where lifestyle medicine is the foundation of health and all healthcare. And our mission is advancing evidence-based lifestyle medicine to treat, reverse, and prevent non-communicable chronic diseases. And so we educate, equip, support, empower our members to do this type of work. And next, I want to give you some examples of some stellar nurses, nurse practitioners who work in the lifestyle medicine space. And I know that I'm going to be missing some of them in this part of the presentation. And so this is a shout out to every single one of them. And I'm sure there are a lot of you out there doing this kind of work, and and we haven't had a chance to meet yet, and I would love to meet you all. But anyway, we do have a strong RN APRN member interest group at the American College of Lifestyle Medicine. And these are our 3 fearless leaders, and really happy to network, connect with you, support you. So Deborah and Krista are both NPs, and then Carla is a faculty at NYU teaching nursing students. A few years ago, we did put out a webinar. And even though it's gotten a little older, I'd love for you to view it if you are interested in lifestyle medicine. These are 3 of basically our nurse practitioner pioneers in lifestyle medicine, sharing their stories and what they've done in the field. Then also, we've got Erin, who is heavily into lifestyle medicine health equity work. And then Tammy and Cody both are co-lead the Nurses Nutrition Network, and ACLM and Nurses Nutrition Network have worked together very nicely, sharing information, and they do quarterly presentations. So watch out for those. You can sign up for their presentations. And then Cody is not only faculty who teaches lifestyle medicine within the school she teaches at, but she also has a company, and that company teaches people to eat healthy. There is Aaron Stuber, who was one of our early adopters of lifestyle medicine into his nursing practice. And he has a podcast that was from 2019. But you can still access it online, and it's a wonderful example of what nurses can do in lifestyle medicine. There's also Karen Lang and Donna Myers, who both are nurse health coaches who help work with patients to reverse their cardiovascular disease. Both of them have extensive training in cardiology and have made that their work. We also have Susan Spell, who has a podcast and interviews lifestyle medicine leaders, and she has quite a series of lifestyle medicine podcasts. So you can find her on Apple, and it's Return to Vibrant Health's Susie Spell. And then there's also Josie Bidwell, who is the very first fellow of the American College of Lifestyle Medicine, who is a nurse. And she and I too would love to have more nurse fellows at the American College of Lifestyle Medicine. Know that that is an opportunity for you. And so again, I know I didn't mention every single one of the incredible nurses who are leading the way with lifestyle medicine, but want to shout out to all of them. Now, I did mention that what my work entails is helping support faculty who move lifestyle medicine content into their curriculum. So if this is something that you are interested in, please hop on this webpage. If you search for lifestyle medicine academic pathway, it will show up and give you more information about what that entails. And I would be thrilled to meet with any of you who are interested in this. And this work aligns with the lifestyle medicine core competencies. So the original competencies were written for physicians, and in 2022, an update was published in which a global group of experts in lifestyle medicine put together what they feel is the core competencies of the whole lifestyle medicine team. And so certainly over time, this will be revised, but this is the seminal work in this area. All right, and we do have a couple of textbooks that are available specific to nursing. Dr. Lily Downs and Dr. Lily Tryon, who both are pioneers in lifestyle medicine in nursing, have a book called Health Promotion and Disease Prevention for Advanced Practice coming out this fall. So late October, that will be out. And there is already a book called Lifestyle Nursing that was edited by Dr. Gia Merlot, who is not a nurse. However, in all the chapters, nurses wrote about lifestyle medicine, and leaders in nursing each took a chapter and discussed how we can utilize lifestyle medicine within nursing. Okay, and if you're in the United States and you're wondering, well, where is this kind of work happening? If you haven't heard about it yet, these are some of the strong health systems that are really leading the way in lifestyle medicine. So if you even search online for these health systems and search lifestyle medicine too, you can find the clinics that they are running and some of the work that they are doing. It's really exciting. Right. And if you are wondering, well, how can you engage more in lifestyle medicine? There are so many ways. It's really, really exciting. I think two ways that I will point out for now are group visits and telehealth. And so as far as group visits go, shared medical appointments tend to be a wonderful way for us to reach a larger audience, and then also for reimbursement to occur. So Dr. Josie Bidwell and I did write and publish an article on this, and you can find it on an in an online free resource. It's the Journal of Family Practice, and you can actually have access to all of these articles on lifestyle medicine. So it will give you a good idea, a solid foundation of what you can do. But I just wanted to point out that there's one specifically that talks about the billing of shared medical appointments, how to do them, and hopefully is just kind of a basic guide for you to get started. And there's just a snapshot of it. And then also there are lots and lots of articles through the Journal of Lifestyle Medicine. Here's just one example of that. Many of them are open access, so you are welcome to download those. And for those that aren't, if you are a member of the American College of Lifestyle Medicine, you have access to all journal articles. If you are within a university setting, you can have access to them. If you have specific needs and you're not able to find what you want, please reach out to me and I will help you. Okay, and it's just some examples of lifestyle medicine programs. And you don't have to do all this yourself. There's a lot of work that's been done already. If you don't have time to do this within whatever your practice is, you certainly can refer people where they need to go. Diabetes prevention programs are throughout the country, and these are to reverse prediabetes. So anyone really who is screened for screened and diagnosed with prediabetes has a wonderful opportunity here to get into these lifestyle programs to help them reverse their prediabetes. And certainly, if we can catch the condition at that stage instead of further on, that would be wonderful. We talked about cardiac rehab, and then intensive cardiac rehab has the exact same indications, the exact same reasons it's covered by CMS. And the difference, though, is that it is a program that is for putting cardiovascular disease in remission. And I have another slide I'm going to show you on that. There's also a program called Pivio that can be online and you can do in your clinic. And it's kind of just a package deal of lifestyle medicine interventions that you can do in a group format. So that's an option. I did want to point out New York City, and that a shout out to them. They're doing amazing things in the lifestyle medicine realm. And if you search for New York City, Governor Eric Adams lifestyle medicine, you can watch the recent announcement that he made that there will be lifestyle medicine clinics throughout every public hospital within New York City. So this is really exciting. So when they have those people there who are newly diagnosed with chronic diseases, they can very quickly get them into those lifestyle medicine clinics to help them to not need, hopefully, further medications and to keep their disease from progressing, and instead to help them to have their disease regress. Also wanted to give a shout out to the VA, who's doing some incredible work with lifestyle medicine. And they also have a whole health program that is worth exploring if you are not familiar with that. And it really is such person-centered care, very exciting. Okay, so I mentioned to you that intensive cardiac rehab programs have been covered by CMS since 2010. And just in case you need it, here's the documentation related to this. Now, the interesting caveat is there's only two types of these programs. There's the Ornish program, the Pritikin program. So those are the ones that you will see throughout the United States. Benson Henry is its own institute in Boston. It's not it is not franchised. But anyway, looking out for these programs, and you can also do a search online and find out more about them. And for now, we don't know for how long. I mean, it could be this year, it could be longer. The Ornish program is online, and that is a result of the current telehealth policy changes. So to me, this is very exciting because we have people everywhere now that if they have access to the internet can have access to programming that can help them reverse their cardiovascular disease. So very exciting stuff. And I'm very, very hopeful that this will continue past this year. Okay, wanted to share some just quick lifestyle medicine prescriptions or resources that you might want to use. And these are just a couple. But just to kind of get started for you to explore, there are multiple documentaries, and I'll talk a little bit more about those. I live in Indiana, and a shout out to the Optimizing Life documentary. That's one that we did here to really dig into lifestyle medicine in Indiana. There's also one called Code Blue that is fantastic. There are many different apps that you can utilize with your patients, and many of these you probably already are. There are online nutrition resources. One that I want to point out that is complementary is the Big Switch. And another is Full Plate, but I have a slide on that one. As far as activities, there's websites for exercises medicine and park prescriptions, multiple websites. And then as far as nutrition goes, especially for those of you in areas where there are food deserts, food access is hard to come by, really look into food as medicine programs. There may be some through your local health systems. Also look into produce prescriptions. Those may be out of your health department. There may be grants to provide funding for your patients to get produce. So lots of opportunities here. And just wanting to dive a little deeper into a few of these, there is an opportunity called Full Plate Living, a resource that you can find online that has lots of clinician resources, patient resources, community resources, just so much here. And this is a free service from Ardmore Institute of Health. There is a program that can be prescribed called Culinary RX. It does cost. Normally it's somewhere between $40, $100, but it is a deep dive into really healthy cooking. So if you happen to have a patient or a patient's spouse that loves to cook and would love to learn how to cook the types of food that are known to put chronic diseases in remission, this is an excellent resource. And then as the provider, you can actually see them completing the course on your end and can support their journey. There's a documentary called Plantwise, and Plantwise is about 40 minutes long. It was meant to be shown in health systems, but also can be shown in clinics or can be prescribed to individual patients. We show it where I am as a community service through our public library. So we do these documentary showings about every 3 months, and that's been a very positive experience and a way to get the word out there. So you can look up Plantwise. It does have, along with it, a guide to how to implement this within a health system. So you don't have to reinvent the wheel. People are already doing this, and they've shared their wisdom. American College of Lifestyle Medicine has a bundle that we call the Essentials Bundle, and it is an intro to lifestyle medicine module along with a few other food as medicine modules. And we have been a part of an initiative with the White House on hunger, nutrition, and health. And all of you have the opportunity now to take advantage of free lifestyle medicine CME. So this was an article that Cody Stubbe wrote for the American Nurses Association, Healthy Nurse, Healthy Nation. This is all available to you now because of our White House initiative. So if any of you would like to, please scan that code and it will take you right to our site so that you can sign up for this Essentials Bundle and you can take it at your own pace and learn more about lifestyle medicine. Okay, and then we also at American College of Lifestyle Medicine are really monitoring, how can clinicians get paid for this kind of work? We did some research a few years ago on the landscape of reimbursement for lifestyle medicine. We do have a reimbursement roadmap that we put together and update yearly. We also have a member interest group specifically focusing on reimbursement for lifestyle medicine. And just wanted to share with you some of the other opportunities at the American College of Lifestyle Medicine, besides the education you can get, and then also being part of the member interest groups. We do have an annual conference. The next one will be this October, end of October in Denver. So please join us if you can. Certification is available for nurses who have a master's or a doctoral degree. And then we have lots and lots of resources for faculty. So if you are faculty and you want more lifestyle medicine resources, reach out to me. I will give a quick shout out to one resource that is just really incredible, and that is lifestylemedicineeducation.org. So that is a USC open access educational resource on lifestyle medicine that they're constantly updating. And I'm happy to share that link with you as well if you email me, but that is a fantastic resource. And so here is our website, lifestylemedicine.org. And then the American Board of Lifestyle Medicine is our certifying body. Now, we also have the Lifestyle Medicine Global Alliance. So if you go to lifestylemedicineglobal.org, you can see all of the lifestyle medicine organizations throughout the entire world. And really, our hope is for every single country to have one, but we've got organizations in Korea, Saudi Arabia, Australia, the Philippines, India. I mean, I could go on and on, but you'll find the whole list there. So please take a look at that if that interests you, or if you want to find one close to you. Follow us on social media if you'd like. And again, feel free to reach out to me. I would love to hear from you. And then also, if for some reason I can't get back to you quickly enough, we also have our support at Lifestyle Medicine email address as well. So either one is just fine. So again, I want to thank you so much for your time today and for allowing me to share. And I do believe we have some time for questions. So I'm happy to have a dialogue here.
Kelly, this has been wonderful. Thank you so much. We've had a lot of interaction through the chat and through the questions. We do have quite a few questions. So I will start with, can you describe the difference between body fat percentage, and is that different between BMI?
It's associated but different. And I apologize, it's been a little while since I've seen that relationship, and I don't want to give the wrong answer here. But those are overweight. So when we're I think the question is about the slide about healthy weight, or health, what defines healthy, and less than 3% are healthy. That's at the higher end of healthy or lower end of overweight, I believe.
Perfect. Thank you. And then let's talk a little bit about your thoughts on coffee. Do you think it's good, bad? What do you think?
And this is something humans do, and we just do this because this is who we are, and sometimes we get focused on one particular food or beverage or whatever. And certainly I have dug in pretty deep to the coffee research, and from everything I can tell, it's pretty healthy. I'd love to see a meta-analysis or two. And you also have to keep in mind, whenever you are looking at any single food item or any single macronutrient, that the research can be a little swayed here and there. So I hope that answered your question. My personal answer is I don't think there's any problems really with coffee, unless you're putting a lot of unhealthy extras into the coffee.
Yeah, and we have a few more very specific questions related to food.
Okay.
Thoughts about artificial sweeteners, monk fruit, stevia. What do you think?
Okay, so I'm gonna give the position of American College of Lifestyle Medicine first, which is first and foremost, try really hard to go for whole foods and primarily plant-based foods. That we know, in general. So this is, big picture here. We know that leads normally to best outcomes. Now, I've seen a few studies with the sweeteners, and there's so many specifics with all the different kinds, but there may be issues with that altering the gut microbiome a bit. Truly, if we can avoid the processed foods as much as possible, that's our big goal. And so, what about dates? How about, applesauce, like ways to sweeten foods that aren't concentrated sugars.
And let's switch gears a little bit because we have a lot of questions coming in regards to practice, insurance, things of that nature. So is prescribing lifestyle medicine interventions only in the scope of practice for APRNs, or could this be part of a general care plan for anyone at risk for lifestyle related diseases?
I would argue it is absolutely part of a general care plan. This is education that nurses have. We are all about health promotion, and I mean, so much of this fits right into health promotion. And I think the thing that we want to be so cautious about is that pivotal point where we have someone who is very engaged and really wants to work on reversing their disease, and that we have risk there. That's where it gets concerning. So we want to make sure that we have someone who has prescriptive privileges, who is actively monitoring blood pressure and blood glucose level and symptoms, signs and symptoms that we need to either get that person's medication dosages way down or get those meds deprescribed. So that's that point where that takes a prescription, that takes a prescriber. However, so much of this can be even within a public health nurse's realm. Or if you are doing, teaching classes within a health system on physical activity or dietary practices, you can share, the most evidence-based ways to improve chronic diseases and improve overall health. So I do believe nurses have huge opportunities within this space.
Yes, I agree. Thank you so much for that very detailed answer. Megan, could you go back to the slide with the QR code? We've had a couple questions, people wanting to scan that, which is excellent. Please scan the QR code. I know I personally have signed up for the course, so I'm really excited to take it. We have about 3 minutes left, so I want to ask one question in regards to clinics that you are seeing in your area. Have you seen a lot of lifestyle medicine clinics in Indiana? I think I saw Eskenazi on the list, but what do you think, Kelly?
Yes. So, I mean, definitely we have a lot of work to do. And as nurses, I'm asking all of you to be a part of this work. In Indiana, particularly, we have the Eskenazi Health System, which is our safety net health system. It's in downtown Indianapolis, and they have lifestyle medicine clinics for their patients. So that is wonderful. Otherwise, it's still a little spotty. We have a few, well, we have some diplomates of the American College of Lifestyle Medicine and American Board of Lifestyle Medicine, and that's who certifies the physicians. We have some of those scattered throughout Indianapolis, and where I'm seeing them doing most of their work is within employee systems, so that they have a clinic within an employer, and that helps cut costs for that employer. And so this is a wonderful place for lifestyle medicine to be. However, I want it to be everywhere for everyone to have open access, and we just don't really have that much yet in Indiana. Go to New York, we've got a lot more going on. And there are just certain parts of the country that are doing more than others, but I have a feeling that the others are going to be catching up. If any of you are really interested in this, I could send you a list of all of the health systems who actually have lifestyle medicine clinics within their health systems. So I do have that information available. And one of those is UMMC. So that's where Josie Bidwell is. And she was the founder of that clinic, I'm thinking like 5 or 6 years ago. And it is a thriving clinic. And she actually teaches family practice or family medicine residents within that clinic. So she's doing really exciting work there. And that's just one example of what's going on.
This has truly been wonderful. Unfortunately, we are all out of time and we are not going to be able to get to all of the questions today. So maybe if we could go back to the slide with Kelly's contact information. This also has the lifestyle medicine link. So we encourage you to use the link where you can access all of the resources from the lifestyle medicine um, content we covered today. We want to thank our presenters so much for sharing all of this great information. Sigma is grateful that you took the time to share with this audience, and we definitely look forward to hearing more from you in the future. We hope you enjoyed this webinar. As a reminder, 1 week from today, you will be emailed a link to complete the evaluation, and also the link will have the ability for you to get the slides. They will be uploaded to the Sigma repository with the recording. Be sure to check out Sigma's upcoming webinars, resources, and podcasts to support you and your colleagues at sigmanursing.org. We want to thank you all for joining us today and have a wonderful day.